Huge news out of Quebec. The Quebec government is going to mostly ban the use of private health agencies starting next year. The goal of this is to help keep nurses in the public system as well as to avoid the rising costs of paying these private firms. Now, there will be some exceptions for the use of private agencies and self-employed workers. But they're going to have certain new measures being applied, including having certain ancillary charges being prohibited, as well as also a limit on hourly rates for certain job titles, as well as an increase in fees billed to an organization for overtime and compulsory overtime. That's a jumble of words, but what it basically means is that the government is going to prevent these private clinics from overcharging the government. Essentially still allowing for these private companies to operate, but limiting the amount of capital that they can make to a reasonable amount that allows us to keep our public system operating. Which is literally what we should be doing when it comes to groceries. And considering the fact that Ontario has quadrupled the spending on private nursing agencies since the pandemic started, maybe, just maybe, we should be looking into this. Although we know that Doug Ford won't do that because former Conservative Premier Mike Harris's wife owns a private nursing agency. And in some cases, these private nursing agencies charge our hospitals $250 per hour, when normally it would only cost on average about $40 to $45 per hour to fund our own public sector nurses. Remember, conservatives are not fiscally responsible. What they are fiscally capable of doing is routing as many tax dollars as humanly possible into the hands of private wealth, because that's what they see as fiscally responsible. They don't care about the quality of service. They don't care about you. They don't care if you get surgery on time or the care that you need. They care about the money.